Hello, I'm David Brahms, and I'm the Director of Surgical Weight Loss at Lahey Hospital and Medical Center. Thank you for taking the first step on your journey to weight loss and a healthier life. Weight loss surgery, also called bariatric surgery, can be a life-transforming operation, one that can dramatically improve your long-term health and quality of life. Since 2000, our program has provided thousands of patients with the support, the knowledge, and tools needed to lose weight safely and keep it off. Losing weight can be one of the most difficult challenges a person can face. We get that. Our team looks forward to partnering with you every step of the way, from preparation to surgery and the post-operative care, making sure that your weight loss journey is a positive one. Obesity is an epidemic in the United States. The rate of American adults with obesity has increased considerably over the last several decades. Currently, 20 to 35% of adults in the United States have the disease known as obesity. Obesity is also affecting children at a rate higher than ever before. Obesity is a medical condition in which a person carries excess body fat and body weight. The most common screening for obesity is called the body mass index, or BMI, which is a measurement of body size based on a person's weight and height. An adult with a BMI of 30 or more is considered to be obese. An individual is considered morbidly obese if he or she is 100 pounds over his or her ideal body weight, has a BMI of 40, or even a body mass index of 35 or more with conditions related to obesity, such as diabetes or sleep apnea. Obesity is a complex disease that typically results from a combination of causes and contributing factors, including their diet, their physical activity, the medications they might take, the environment in which they live, their hormones, their gut bacteria, and their genetics. Obesity is more common in populations whose environments promote physical inactivity and a diet that's high in calorie-rich foods. Weight gain can also be caused by some medications, by hormonal changes in your body, and genetics also play a role in obesity. This means that some people are predisposed and genetically at risk for weight gain and obesity. For example, a person whose parents were obese is more likely to be obese than someone whose parents were normal weight. Most recently, gut bacteria in our intestines, has been found to be a contributing factor to increasing obesity rates. The idea is that these gut bacteria that line your intestines affect how foods are digested and absorbed. And now we're beginning to understand how that might impact people's weight and their ability to lose weight. Obesity negatively impacts your overall health and is associated with a number of health risks, really from head to toe. Carrying excess weight increases a person's chance of developing obesity-related conditions, something we call comorbidities, such as type 2 diabetes, high blood pressure, sleep apnea, joint pain, heart disease, and several forms of cancer. Obesity can also lower self-esteem and lead to depression and a diminished quality of life, and ultimately a shorter life expectancy. An individual with obesity has a 70% increased risk for heart disease, a 75% increased risk for stroke, a 200% increased risk of cancer. In men, there's an increased risk in liver, prostate, colon, and pancreatic cancers. In women, there's a marked increase in uterine and breast cancers. And both men and women, there's a 400% increased risk of diabetes. All of these things come together such that individuals with obesity have a 55% increased risk of death. And obesity accounts for nearly 400,000 deaths in the United States each year. In fact, only about 1 in 7 individuals with obesity will reach their normal life expectancy of 76 years. Life expectancy in the morbidly obese is decreased by 9 years in women, and it's decreased by 12 years in men. There are a number of treatment options for obesity. Probably all of you have been told diet and exercise. And with diet and exercise, obese individuals can expect to lose an average of 5 to 10 pounds of excess weight. Now, if you add medications to diet and exercise, obese individuals can expect to lose an average of 10 to 15 pounds of excess weight. These treatment options alone, though, are generally ineffective for sustained long-term weight loss. In fact, about 95% of people will regain all the weight they lost within 2 years. and often more. Given that medical weight loss is not sustainable for most patients, weight loss surgery is really the safe, effective option for those who've been unable to lose weight or maintain weight loss on their own. Now, weight loss is different for everyone, which is why we offer a variety of minimally invasive surgical options. You and your surgical team will determine which surgery is right for you based on your medical history and your personal needs. Gastric bypass surgery is a procedure in which the stomach is reduced to the size of a small egg to help control portion size. The small intestine is attached to this pouch, completely bypassing the portioned off section of the stomach. Individuals having this surgery can expect to lose an average of about 65% of their excess body weight, and this is sustained even over 10 years. Gastric bypass also provides additional benefits for patients with diabetes or for those suffering from heartburn. Sleeve gastrectomy permanently removes the outer portion of the stomach, creating a banana-shaped stomach. This decreases the amount of food the stomach can hold by about 90%, and it speeds the delivery of food to the intestine, which can impact hormones that help with hunger control and diabetes. Individuals having this surgery can expect to lose about half of their excess body weight. This also allows for the possibility of additional weight loss surgery down the road. Adjustable gastric band surgery involves an adjustable plastic device that was placed around the upper stomach to help control portion size. And for some individuals, this was very effective. This surgery, though, is rarely performed today, since many patients who had the band didn't lose enough weight or they experienced weight regain. In these patients, the band can be laparoscopically removed and a gastric bypass or a sleeve gastrectomy can be performed instead. This is a type of revisional bariatric surgery. Leahy is one of the few hospitals in the region to perform an operation called the duodenal switch. Now, this is a very effective option for the most obese patients and for those with poorly controlled diabetes. In this procedure, a sleeve gastrectomy, which I discussed earlier, is combined with an intestinal bypass, resulting in a combination of restriction and malabsorption and change in those gut hormones that I described that really changes a person's sense of hunger, their satiety, and amount of food and calories they take in. A sleeve gastrectomy that performed in the past can also be revised to include this duodenal switch if an individual has regained weight or would benefit from further weight loss or improved diabetes control. The duodenal switch results in greater weight loss than these other operations that I described, with an average of 75%, 3/4 of one's excess weight. Now, while all procedures completed at Leahy require lifelong nutritional supplementation and monitoring, it's most critical that patients with a duodenal switch be monitored closely after surgery. You can visit our website for more information about each of these operations. Although weight loss surgery is very safe, a variety of complications can occur after surgery. The most common short-term complications are nausea and dehydration. These are well managed with simple interventions. Less common complications, maybe in the range of 1 in 100, include leakage, bleeding, or blood clots. Long-term complications may include nutritional deficiencies, intestinal obstruction, ulcers, weight regain, and heartburn. Complications are specific to the type of surgery you may have and will be discussed by your surgical weight loss team. Now, we're really proud to have complication rates that are lower than the national and regional averages. In terms of results, weight loss is just one of the many benefits you can expect with weight loss surgery. The majority of our patients also experience an improvement in obesity-related health problems. For example, weight loss surgery results in an 83% improvement in type 2 diabetes, up to a 98% improvement or elimination of sleep apnea, a 52 to 92% improvement in high blood pressure, as well as an improvement in arthritis, back pain, cholesterol, and many other health problems. Perhaps most importantly, weight loss surgery offers tremendous improvement in both the quality of life and the length of life, with a marked reduction in mortality. In fact, health risks associated with remaining obese far outweigh the risks of weight loss surgery itself. So why Lahey? With Lahey Hospital and Medical Center, you're choosing an experienced team that's committed to your long-term health and well-being. Our multidisciplinary team, comprised of surgeons, nurse practitioners, dietitians, and psychologists, provides weight loss solutions that are personalized to your needs and goals. This helps you to achieve your long-term results. Plus, we have several locations to make travel to appointments easier. We understand that this is a big investment of your time. Because we are part of a large health system, you have easy access to specialists who treat a full range of obesity-related illnesses. This includes endocrinologists, pulmonologists, and cardiologists, all of who are close to home, no matter where you live. A medical weight loss program is also available if you choose not to have surgery or if you need help with the weight loss before or after your operation. Our program, which performs more than 300 weight loss surgeries a year, is recognized by the American College of Surgeons and the American Society for Metabolic and Bariatric Surgery and the MBSA QIP program as a comprehensive center. This means that our program is regularly evaluated to ensure that our team provides patients with the support, the knowledge, and tools they need to lose weight safely and to change their lives. We offer robust psychological supports to help with behavior change before and after surgery. All of our patients attend a series of classes to support mindful eating behaviors. Our patients also have the option to meet individually with a psychologist if needed, and to attend stress eating, binge eating, or behavioral change classes, or to attend monthly support groups. This will allow you to interact with other patients who are pursuing surgery or have had surgery. Above all, we provide the coaching and care to make sure that you reach and maintain your weight loss goals.
Hello, I'm Sarah Tortorisi, a nurse practitioner and the coordinator for the surgical weight loss program at Lahey Hospital and Medical Center. Now that you've had a chance to learn more about weight loss surgery and our program, you're probably wondering where to go from here. It is important to recognize that weight loss surgery is a powerful tool, but requires a lifelong commitment, so you must be ready to make lasting lifestyle changes. The first step is to check your BMI to see if you qualify for surgery. You can find free BMI calculators online. Just Google BMI calculator or go to our website. You qualify for surgery if you are 18 years of age or older and your BMI is 40 or higher. You also qualify if your BMI is 35 to 39 and you have at least one obesity-related health problem such as diabetes or sleep apnea. If you are not sure if you qualify for surgery after checking your BMI, we are always happy to talk to you prior to your visit. Next, please check with your insurance plan to make sure bariatric surgery is covered. Most plans cover the surgery if you meet the BMI criteria. After you've completed these steps, call our office to schedule your initial consultation with our weight loss team. At your first appointment, you will meet with a nurse practitioner, dietitian, and psychologist to review your goals and medical history and obtain your personalized plan to prepare for a safe surgery. You should plan to be here for about 4 hours. After this initial appointment, you'll have regular meetings with your surgical team, including your surgeon, in the months leading up to surgery. Typically, we ask that you lose about 7 to 10% of your body weight prior to surgery. This may be different from patient to patient based on your weight and how you carry your weight. This preliminary weight loss makes for an easier and less risky surgery. Support groups and classes are also available to patients. The average time from consult to surgery is usually 3 to 6 months. Weight loss surgery is life-changing and will be with you every step of the way to make sure you stay on the road to long-term weight loss success. You will see members of our team frequently in the first month after surgery, and then every 3 to 6 months for a year or two, and then annually thereafter. We are here to support you for life and can customize your follow-up to meet your specific needs. Our surgical weight loss team looks forward to working with you and helping you start your journey.
We hope that you found this video and information helpful as you consider weight loss surgery. I know that as a surgeon, having done this work for more than 20 years, it's one of the most valuable things that can be offered to you. A short operation, along with a program like ours, gives you the tools to change your life. To learn more about our program, visit our website. Here you can read testimonials from our patients, view frequently asked questions, and more. If you're ready to take the next step toward weight loss success, please call us to schedule a consultation. Thank you.